Lined with trees and grand old architecture, Vientiane's boulevards haven't changed much since this nation was a French colony.
This is peak hour in Vientiane, and compared with other Asian capitals like Beijing, Jakarta, Manila or Bangkok, it's not nearly as chaotic or crowded.
With the economy in Laos booming, more people can afford bikes and cars than ever before. And they drive those vehicles at breakneck speeds, down long straight roads with few traffic lights or roundabouts to slow them down. The death toll from road accidents in Laos increased by 26% in just the last year.
There's no will to change anything here. So that's the biggest problem. Nobody cares. It's helping a lot to save people.
Sebastian gained his medical skills in Paris as a paramedic. He set up Vientiane Rescue in 2010 after witnessing a terrible accident near the main hospital.
It was a bloodbath. One of them was dead already, and the other one was very, very seriously injured, and he was unconscious. I knew at this time that there were no emergency service, but we are very close to the hospital, so I was expecting, some ambulance or doctors coming outside of the hospital to come to pick up the body and give people the instructions to be careful. But no, nothing.
Only 1 in 5 drivers in this city has a licence. It's a frightening thought as we hurtle through the traffic.
I think we're lucky and we have a good sirens, because in 4 years we never had a crash. But maybe we're lucky.
What does the driver have to watch out for?
Everything, because there are cars coming the wrong way, there's not much light, and there are so many people drunk. But we are making a lot of noise, so I think it's part of the safety. I hope.
I hope too.
The majority of accident victims can't afford medical care. Vientiane Rescue takes them to hospital free of charge. But the service itself is strapped for cash.
We managed to run the service for almost $2,000 a month. But the point is that if tomorrow we have an accident and we lose one of our cars, it's going to be forever. We're going to lose it and we're not going to be able to buy a new one.
Because you're uninsured?
We are not insured, and the second thing is that we can't maintain the car. Last time we had an accident because the brake ripped.
Vientiane Rescue work from a small office in the shadow of Tat Luang, the capital's grandest landmark. Staffed by volunteers and existing only on private donations, it's a battle to survive. Sebastian tells me the service saves money wherever they can.
So this is the basic equipment we have. So we have our bandages that we use and reuse. Usually it's supposed to be disposable, but this kind of bandages, it's like $2. And we use this a lot, so
how many times do you have to use a bandage again and again?
As soon as it's usable, it's fine. So we also have a cervical collar. So this is to immobilize. It's very dirty as well, but it's made of plastic, so we try to wash it, but it's supposed to be disposable.
But one of the main challenges that you have is hygiene, because you're in... Yeah,
that's hygiene. Yeah.
Recently, 2 second-hand ambulances from Japan were donated to the service.
Tell us the story about this ambulance.
The problem is that everything is written in Japanese, so I had to ask some friends to come to give us the translation. And as you can see, also the wheel is on the opposite side. And it's funny because the guy who came for the translation used to be a rescue guy in Japan. And he saw the car and he was like, "Oh, you have to be very careful because if you take a curve too fast, you can just roll over."
So when you got this given to you, they just dropped it off and said, "Good luck with it."
Yeah. But we're happy, it's a vehicle that we can use, and this kind of ambulance, if we had to buy it, would have cost like $20,000, and we got it for free, so that's good.
But when we drop off the injured, we find the hospital's own ambulances sitting unused. They're provided for free by foreign donors, but hospitals charge patients to use them.
What do they do?
Transfers. and they can pick you at home if you're sick, and especially if you have money, because it's a paying service. So they have brand new ambulances donated by Japan, Korea, private companies.
Does that frustrate you?
Sure, yeah, look at this one. It's like $80,000. For what? Transfers? From people who has money? What about the others?
In most provinces around Laos, people die from preventable injuries by the roadside because there are no ambulances to rescue them. Even hospitals here often struggle to take care of patients. One evening, a local hospital calls Sebastian's team to ask for help with a car accident victim. The man is choking on his own blood. The team clear his airway with a rubber tube. Then they transport him to another hospital.
When someone has a very serious crash and the family is able to pay for the care, they go to Thailand, they don't stay here. So I think, maybe there's some troubles with the healthcare system here.
Laos is an authoritarian one-party state. The government declined our request for an interview. But we were given access to the ICU of Vientiane's main hospital that handles most accidents.
I think that 2 people here with head injury.
The deputy director says despite rising road fatalities, they don't have enough qualified staff to help accident victims.
All the hospital, they don't have enough human resources who are specializing in dealing with this situation, like a head injury. The whole country referring to our hospital. We cannot provide the service to all people because we need more specialists, need more equipment. We have only 2 head injury surgeons. Sometimes we need more for operation.
So you've only got 2 head surgeons in this hospital or in all of Laos?
Yeah, in all of Laos we have 2 surgeons that dealing with head injury for operation.
This hospital received 1,000 crash victims in the last month alone. But many road fatalities in Laos remain unreported, as those who die on roads are sent straight to a temple for burial.
Based on what you see here in this hospital, do you think the government statistics of road accidents are accurate?
It's not very, because if patient dies, sometimes they did not bring to hospital. In other countries, when the car accident, even patient die in the scene, they bring to hospital for statistics. But in Laos, cannot say that accurate, because we'll miss a lot of cases.
It's not just speed and no helmets creating a high death toll across Laos. Drink driving is the biggest cause of accidents. According to the World Health Organization, this country is the second biggest consumer of alcohol in Southeast Asia. Today, Soy and Sebastian are treating 2 men who were riding a motorbike drunk when it hit a parked car. One has a broken leg. When they reach the hospital, the other man loses consciousness.
70 to 80% of the guys we pick up on the road, they're totally drunk like this. So it's very difficult to know if the guy lost consciousness because of the head trauma or just because he's totally drunk. Yeah. So that's a bit complicated for the medical staff.
On the weekend, many people drink to excess from the early afternoon, and then they drive home. Sebastian says there are few deterrents to stop them.
You know, if you're drunk, if you don't have a license, if you don't wear a helmet, if you get catched by the police, you're not gonna go to jail. So there is no consequences actually.
For years, COPE has been helping landmine victims from America's bombing campaign in Laos during the Vietnam War. But the group's CEO, Bunlang Paipon, says the biggest demand for prosthetic legs is no longer from landmines. It's from road accident victims.
There's a rising number of car accidents here, but no one talks about it. There are organisations that deal with the road accidents, but no one, be it journalists or other sectors, comes to talk about it, like they do with landmines. Awareness about wearing helmets is improving, and more people are surviving bad injuries after a crash. But helmets don't protect legs.